Danielle, and we're here today at the knee joint. And we're making a video today about how movement can cause knee pain. So yeah, there are many causes of knee pain, although not all of them can be fixed by physical therapy alone. In many cases where the pain is related to movement, physical therapy can give you pain relief and get you back to what you love. So today we're going to go through a few movements that we typically include in a PT evaluation here, and we're going to really assess if the way you move may be causing your knee pain. So feel free to follow along with me. Grab maybe something like this, like a broom if you have it, or the back of a chair would work just fine. Okay, so first we're going to start. Danielle here is going to demonstrate the exercises or the movements. So first we're going to start with a single limb stance. So Danielle, go ahead and stand like so on one foot. Okay, good. And so as we see on Danielle's right side, it looks really nice and solid. So she's not having any shakiness or movement here. So it looks really good. All right, Danielle, show me the left side now. Okay, good. So with this, as you can see, Danielle's knee is very shaky and kind of moving around. So the joint in there isn't as steady and firm as it was here. So if we kind of look at the knee, so with Danielle's left, it was kind of shaky as she was standing on that one leg. And we spend a lot of time in stance phase in our life, so that'll make a big impact on your knee if it's moving around like that. So now you see as compared with the right leg, Danielle's alignment here is definitely not stacked over her pelvis. So her torso is really leaning to the left there. And that has a lot to do with weaknesses in the hip and around the knee. All right. So next we're going to go to a double limb squat. So Danielle's going to show you two different ways that many people squat. So first let's start with that knee dominant squat is what we call. Alright, good. So as you see, when Danielle bends down, her knees go way over her toes. And that can just cause a lot of knee pain as all the forces in the quad really kind of impact that knee. So now we're going to see a hip dominant squat. Good. Good. So with this one, Danielle has engaged the muscles in the back of her leg also, which helps alleviate a lot of the stress placed on the knee. So a lot of people who have a more knee dominant, can you show it again, Danielle? More knee dominant squat, they can have a lot of knee pain. Okay, so now this is single limb or double limb squat from facing this way. And with here, we really saw as Danielle went down, her knee caved inward and collapsed inward. And that has a lot to do with weaknesses in the hip muscles. So it's not able to control that knee as it goes down, and that also can create a lot of knee pain and discomfort. Okay, so now let's move on to a single limb squat. And again with this, good. So we're really looking for if the patella stays over the dorsum of the foot, the front of the foot there, and it stays nice and outward, good. And so let's go ahead and see that on the left leg. Okay, and again with this, so we see how Danielle's leg really collapses in. And again, so for the same reasons, that can just create a lot of discomfort in the knee. Okay. So now let's see, it's single limb heel raise. And yeah, for this one, feel free to use something for support because it's a more difficult one. Good. Okay. Looks good. See it on that left leg now. And for this one, as you can see too, so Danielle's quad isn't using enough control to really lift the heel up. So that too are things we look for in the evaluation and is a really common cause of some knee pain. So if you've experienced any of these noticeable asymmetries or any pain with these movements, you may be a great candidate for PT. So we're here to help you at the knee joint via telehealth or in-person evaluations. So don't hesitate to contact us. Thanks for following along.